Hello friends, I'm Dr. Brar from Brar Eye Center, Ludhiana. Today I will be talking about glaucoma, also known as Kala Motia or Kala Motia in Punjabi and Hindi respectively. So what is glaucoma? Glaucoma is progressive, chronic, insidious damage of the nerve fiber layer of the optic disc, which is usually irreversible. Therefore, once glaucoma damage has set in, it is extremely difficult to reverse it. Hence, the mainstay of treatment is basically chronic and regular screening every 6 monthly with a visual field analysis and the OCT RNFL analysis of the nerve fiber layer health. So once the patient has developed some degree of damage, you do not need to worry. Even if there is advanced glaucoma, we will try to titrate your pressure up to the target pressure that we will determine for this patient, and thereby preventing further progression and maintaining the vision of the patient. Patients who have a family history, a genuine family history of blindness due to glaucoma, need to be checked as soon as possible, as well as if you know that you have had someone of your near and dear one who has been diagnosed with glaucoma, you need to have a detailed examination of the 5 things that I just mentioned regarding your suspicion for glaucoma. If the doctor tells you that you are all good, that is good news for you. If he puts you in the suspect category, that is, if he suspects that you might develop glaucoma eventually, then again you need to come to the doctor every 6 months and get your glaucoma screening from a trained and extremely competent glaucoma ophthalmologist. And some patients are generally at risk of glaucoma, that is, if you are a myope, that is, you have a minus number, or you're a far-sighted person, then you might be at a higher risk of developing glaucoma. Diabetics again can have a higher risk of developing glaucoma, and as I mentioned, family history is the mainstay and the most rule of thumb kind of etiology that we tend to adhere to. And lastly, what is the symptom of glaucoma? That is something which patients tend to miss. Chronic headaches, evening time headaches, or headaches not going away for any reason despite medications, or repeated change in refractive errors, or reduction in the ability to read in dim light. If the patient repeatedly wants brighter light to read, normal print is also a sign that the patient might be developing glaucoma. So these are very small, very insidious signs, and a patient who is aware and intelligent usually tends to pick them up, but sometimes they get missed by the patient. So these are kind of very small telltale signs you need to be very, very aware of. For further information for our patients, we have 3D animated videos which will be playing on the slideshows hereafter in Hindi and English regarding any other queries you might have for glaucoma or Kala Motia. Also, you can consult someone at the help desk regarding a professional consultation with your doctor. Thank you.
What is glaucoma? A disease of the optic nerve head caused by too much fluid pressure in the eye. Optic nerve damage. It's not an infection and not contagious. How does glaucoma happen? If a sink has a leaking tap, the water will flow through if the drainage mechanism is alright, but when the drainage is blocked, the water begins to collect. Same way, when the eye's drainage mechanism gets blocked, the fluid gets collected in the eye. As the fluid builds up, it starts to exert pressure inside the eye. How is glaucoma spotted? In the early stages, glaucoma can't be seen or felt by the patient. It's usually spotted during a routine eye checkup or discovered by the patient only after a certain amount of damage has already occurred. Damage appears as a gradual visual change and then loss of vision. Are there different types of glaucoma? There are 2 major types: chronic or open-angle glaucoma. Acute or angle closure glaucoma. Occurs as a result of aging. Painless. No warning symptoms. Progresses very slowly. Occurs suddenly. Progresses rapidly. Who is at risk? Everyone is at risk for glaucoma. But, it's more likely to develop in older persons. People over 40 years of age. Having a family history of glaucoma. Having physical eye injuries. Having diabetes. Using steroids for a long period of time. Wearing thick optic glasses from long time. How is glaucoma diagnosed? There are 4 tests used to diagnose and monitor the progression of glaucoma. Tonometry measures eye pressure. Gonioscopy inspects eye's drainage angle. Ophthalmoscopy examines optic nerve for damage. Barometry tests peripheral, side, vision. Is there a cure for glaucoma? When detected early, glaucoma can be successfully controlled to prevent further damage and thus preserve vision with eye drops, laser, surgical operations. Although glaucoma can be controlled, any already occurred damage can't be reversed. Periodic eye examinations are vital in controlling glaucoma. Can glaucoma be prevented? Early detection and treatment can help in prevention. Get glaucoma check as part of regular eye checkups. People at higher risk for developing glaucoma should have their eye and optic nerve checked every year or 2 after the age of 35. Everyone is recommended to get a thorough glaucoma check around the age of 35. At age 40. Then one every 2 or 3 years after age 40. Medications. 1. How effective is medication? Medications can work in 2 ways. Increase the drainage of fluid in the eye. Decrease the production of fluid in the eye. Medications can be either eye drops or pills or a combination of both, which can safely control eye for many years in most cases. Medication must be taken regularly according to the schedule prescribed by your doctor. 2. What about side effects? Medications may have some sort of side effects, which usually become less noticeable after a week or 2. Side effects could be redness of the eye, mild irritation. Don't hesitate to ask your doctor about any physical, emotional changes that occur while taking glaucoma medications. 3. Is it okay to change medication? It's normal for medication programs to change. Type, dosage of eye drops may gradually lose its effectiveness and be replaced by a stronger version of the same drug or a different medication altogether. Having to change medication doesn't always mean that glaucoma has worsened. 4. When is surgery an option? Surgery is the primary treatment for acute glaucoma. It's usually scheduled for only one eye at a time. There are basically 2 different methods of surgery. Laser surgery. A laser is a tiny powerful beam of light that can make a small burn or opening in tissue. Microsurgery. A microsurgical instrument is used to make a tiny opening in the sclera, to create an artificial drainage canal. Helping your doctor will help you. Having diagnosed and knowing you have glaucoma puts you one step ahead of the disease. Together with your doctor, you can work towards protecting your vision in the years ahead. If you are a newly diagnosed glaucoma patient, get your eye levels checked every week or month until they are under control. See your doctor several times a year for regular checkups, even when your eye is at a safe level. Discuss with your doctor about concerns and questions you have and get more information on your treatment options. Make it a point to talk to your doctor about doubts and queries you may have, however minor they may seem. The 7 Commandments to manage glaucoma. Here are 7 basic commandments to help you manage glaucoma. I will visit my doctor regularly, even when I don't have symptoms and my intraocular pressure is under control. I will take my medication regularly as per my doctor's instructions. If I forget to take my medication, I will take it as soon as I remember, and not wait till the next scheduled dose. I will immediately report any unusual symptoms or changes to my doctor. I will always carry on my person an identification card stating that I am being treated for glaucoma. I will make sure I always have an extra supply of medication on hand. I will take care of my eyes and the rest of my body by maintaining an overall healthy lifestyle. How to open the eye drops bottle. Before opening an eye drops bottle, thoroughly wash your hands with soap and water. Read the instructions on the bottle. Inspect the eye drops and check the expiration date of the container. Gently shake the bottle or roll the bottle between your hands. Avoid harsh shaking. Remove the cap from the bottle and place it in a clean place. Avoid touching the tip of the container. How to use your eye drops. Step 1. Sit down and tilt your head back or lie down with your head flat and look at the ceiling. Step 2. Make a pocket in your lower lid by pulling it down. Step 3. Put a drop in the pocket without touching your eye with the bottle. Step 4. Close your eye and gently press your finger against the inside corner. If you're using 2 or more kinds of drops at the same time, wait several minutes before putting the next drop in the eye.